Hello everyone. Today I'm going to talk a little bit about triglycerides. We spoke about cholesterol last week, so it's natural for me to talk about triglycerides. And one of my friends on Facebook asked me, what is triglycerides? When he saw the video about cholesterol. And I think the two go together because a lot of times when you do blood tests, you're looking for cholesterol levels as well as triglyceride levels. And if they're high, they usually tend to be high both, but they can be independently high. So one is high, not the other. So anyway, if triglycerides and cholesterol are both high, then it can indicate that you're at a risk of heart disease or stroke, clot in your brain. And so it's very natural to ask that question. So let's talk a little bit about triglyceride and what its relationship is with cholesterol. So triglyceride, folks, is fat. Cholesterol is not fat. Cholesterol is a waxy substance that is associated with eating a lot of fat. So if you eat a fatty food, it'll stimulate our liver to produce more cholesterol. And high cholesterol is actually bad. Cholesterol, like I said last week, it's used for many different functions in the body, including cell walls. Anywhere there are cell walls, and our body is full of cells, it requires cholesterol. Same with nerves; they're all over our body, and nerve walls require cholesterol. So we know that cholesterol needs to be transported throughout the body, and that's why it's in the blood, right? It's a good thing it's in the blood because then it gets transported everywhere. What are the triglycerides doing in the blood? Well, the triglycerides are one way in which the fat is packaged and shipped all over the body, so that it can be stored in the fat cells. The role of triglycerides is it's like a bond, or it's like a traveler's check. It's for future. It's not for immediate use. Whereas cholesterol needs to be used immediately for different body functions. Where do we get triglycerides from? We get them from two sources. They're both dietary. Triglycerides, our body produces triglycerides, but it can also come from diet. So if you're eating food that has a lot of fat in it, the fat gets absorbed into the blood, and that fat then circulates as triglycerides. So triglycerides are, sometimes if you notice some of the videos on YouTube, once the blood is drawn, and if it's contains a lot of fat, the fat will settle at the top of the test tube, and those are the triglycerides. So triglycerides are a way for our body to transport the fat that's absorbed from our food and stored into the fat cells. That's how the triglycerides are. That's how the fat circulate throughout the body. The cholesterol, on the other hand, is packaged into something called as lipoproteins. It's fat and proteins together. They're packaged together and they circulate all over. So that's how the cholesterol travels. And that's why, LDL, or low density lipoprotein, and high density lipoprotein, it tells you a little bit about cholesterol. That's because cholesterol is packaged together with lipo and proteins, fat and proteins together, so they can be transported throughout the body. Alright, so let's come back to triglycerides. If the triglycerides are high, you're at a risk of damage to your blood vessels, to your heart, to your brain, and so on. So one reason was that fat, if you eat food that's high in fat, it can raise triglyceride levels. What if somebody is not eating a lot of fat? Can they still have high triglycerides? Yes, they can, because our body can produce triglycerides or fats from sugar, from simple sugars. So if you take a raw sugar, if you eat that, keep eating that all day, eat it excessively, yeah, our body is going to convert it into fat. But who eats raw sugar, throughout their days? Well, if you're drinking fruit juices every single day, morning, afternoon, evening, you're going to get a lot of sugar, simple sugars. So there's a difference though between glucose, like the table sugar is mostly glucose, whereas fructose, which is comes from fruits, is our body treats it differently. So if you have a lot of fructose, it gets turned into fat faster. So where does fructose come from? Fruits, fruit juices. But hey, high fructose corn syrup, where do you find that? Almost in everything. Anything that's sweetened these days is sweetened with high fructose corn syrup. So if you're eating a lot of sweetened with fructose type of drinks or foods, processed foods, then you have to be careful about your triglyceride levels, because our body will then convert those sugars into fats. But if you eat rice, whole wheat bread, whole wheat brown rice, and whole grains, basically, you don't have to worry about those turning into fat. You have to be concerned about eating fat. If you eat fat, that'll turn into fat. So there you go, folks. Your triglycerides levels are basically level of fat in your blood, and that's in the blood because it's taking the fat from your diet and it's packing it into your fat cells. So I hope you find this information helpful, and next time you do a blood test, keep an eye out on triglyceride levels and cholesterol levels. They can be high together or they can be high separately. So if you're not eating a lot of cholesterol, if you're not eating a lot of saturated fat, like fat that comes from animals or dairy, if you're not eating, or coconuts, if you're not eating those things, then probably your cholesterol is going to be low. But at the same time, if you're eating a lot of sweet stuff, then your triglyceride is going to be high. So, but if you're eating a lot of other fats like cheese and meat and coconuts, your cholesterol will also be high. All right, so we'll come up with the next subject for next talk. Have a good week. Bye.